Thank you. Please be seated. We'll go on the record in the matter of State of Utah versus MacNeill. Mr. MacNeill is present with his counsel. The state's attorneys are here, but not Mr. Perkins.
We're okay to go forward without Mr. Perkins.
Thank you. Counsel, is Dr. Perper's written report a part of the record? I think it was
it is.
An exhibit to one of the memoranda. I can't remember.
Yes, I attached it as an exhibit.
Okay, I'll give this one back to you then. Dr. Perper, if you would retake the witness stand. Any housekeeping matters before we start?
There is one, Your Honor, that Mr. Grunander and I were just discussing, and I don't know whether we'll get to them today or not, but there is a possibility of getting to the
Okay.
And we had submitted in our 404B some parts of the statements that we think should be excluded from the inmates pursuant to 404B, and we'd like to be able to address that before they take the stand.
How long will that take?
Judge, we haven't, this is the first time we spoke just 5 minutes ago during the break about the issue. We planned to possibly put an inmate or two on the stand today, although I don't think we're probably going to get there. I wonder if we even reserved a little bit of time this afternoon.
I don't see here, and I can read it to you, the entire thing, what I specifically criticize any doctor or Dr. MacNeill in particular. I don't see his name mentioned.
Asking you about criticizing Dr. MacNeill. I'm just saying that you drew the conclusion on Nancy Grace that you believe that Michelle drowned, correct?
Yes, I said that. Yes,
right.
I said that based on the initial information,
right,
it appears that he's drowned. I also mentioned that we don't have the entire information available.
Dr. Perper, please don't just go on. Answer my question, and then this will go much quicker.
Well, I tried to answer your question entirely. I'm sorry that I didn't do that.
Okay. So, just to be clear, in December 7, 2010, based upon the information that you had, you formed the opinion that Michelle MacNeill drowned, correct?
Yes. This is an apparent information based on very limited information.
I understand. And as you were having this conversation with Nancy Grace, there was discussion about CPR and how that could be some evidence of drowning, correct?
Yes.
And Nancy Grace says, the fact, doctor, that all of this water, Dr. Perper, was expelled when the EMTs got there tells me that he did not perform CPR on her, even a novice that performs CPR on a drowning victim. And you said, exactly. And she goes on, water pours out of your nose and mouth. It just pours out when you start pumping. And you answered, absolutely.
Yes,
right?
correct.
Okay. Are you aware in this case that when Michelle was pulled out of the bathtub, that CPR was then performed with Christy Daniels initially doing chest compressions?
By Dr. MacNeill?
Dr. MacNeil doing breaths and Christy Daniels doing chest compressions?
Yes, my information.
I'm just asking if you're aware of that.
I am aware of that.
Okay, and you're aware that no water was reported pouring out of her mouth or nose at that time, right?
That's correct.
And you're aware that after Christy Daniels had done some compressions for a period of time, then she was replaced by her husband, Doug Daniels, who continued to do compressions?
I understand that after she was taken out of the water and there was please let me finish, because otherwise you don't know what's my answer.
Dr. Perper, let me just intervene here. On cross-examination, most questions posed to you will call for a yes or no answer.
Okay.
If there's a concern or you feel like you have something to explain, Mr. Grunander will have an opportunity to examine you further, and I'm sure he'll take careful notes. Go ahead.
So you understand that after Christy Daniels performed compressions for a time, she was replaced by her husband Doug Daniels, who performed compressions?
Yes.
And then after Doug Daniels performed compressions for 1 or 2 minutes, what seemed like an eternity, that the police officers got there and then they took over performing compressions in the bathroom?
Yes.
And that at that time, Josh Motzinger was doing compressions and Officer Ormond was doing the ambu bag in the bathroom?
Yes.
And at that time, there was no water pouring out of her mouth or nose?
I don't recall it, but I think that the water was after she was taken in the other room.
And so then after they did CPR for a minute or two, which seemed like a long time to them, she was then taken to the bedroom, correct?
Yes.
And then they switched, and Officer Ormond began doing compressions, and Officer Motzinger then began doing the ambu bag.
Yes.
And after a period of time, as the paramedics began setting up, then there was this expulsion of water.
Yes.
So there was quite a period of time that passed during CPR before water was actually expelled.
There was some period of time, yes.
So it's not like it was represented on Nancy Grace that you agreed with, that if somebody's drowned, then water would immediately begin coming out the mouth or nose, correct?
What I said on Nancy Grace is based on the information I had at this time. Yet if there is compression of the chest, which is significant and appropriate compression of the chest, there's going to be expulsion of the water, as it was in this case. At the time when I answered, I did not know whether there was an initial resuscitation attempt, whether this resuscitation attempt was effective, and therefore my question is based on a theory that proper and immediate resuscitation was performed.
Okay. And so then it was roughly 10, 11 months later that you were retained by the Utah County Attorney's Office, right?
Correct.
And how much are you being paid for your testimony?
So far, I think I don't remember the exact amount, but I think it is between $10,000 and $14,000, somewhere along this kind of.
Okay, and you'll be compensated more for your testimony here in court today?
Not yet.
Not yet, okay. And after you were retained, then you were given lots more information to review, correct?
Correct.
And you've received additional information even as recently as this past summer, correct?
Correct.
And in the course of reviewing the information, you also received the toxicology report that the medical examiners completed, not the lab test that's the exhibit up there.
Yes.
The toxicology that has the oxycodone and such on it. Right?
Correct.
And at the preliminary hearing, you indicated that that on the initial autopsy, those drugs were found correctly as being in therapeutic dose, correct?
Yes.
And you said, and in my opinion, though the drugs might have contributed to the death in some way, to the drowning, they were not the cause of death.
That's correct.
That's your opinion, right?
That's my opinion today, too.
And you also indicated at the preliminary hearing that you believe the medical examiner who did the autopsy missed a number of findings, which were obvious in the autopsy, right?
That's correct.
And which included the fact that the individual, Michelle, did not have evidence of foreign body reaction in the lungs as it was made.
That's correct.
And so you believe that the autopsy did have evidence of foreign body reaction in the lungs that wasn't noted by the medical examiner.
No, I think that you misunderstood me.
Oh, okay.
I said in my report, I said that there was no, in her report, Dr. Fricke mentioned, I think, the presence of granuloma. And I said that there was no granuloma, there was some scarring in the lungs. And later on, in the photographs which I took, I documented that scarring.
And you testified today about your belief that there was inhalation of a lot of water into the lungs, right?
I believe that there was water in the lung because there was additional, because for a number of things. Number one, as I mentioned in my initial report and also during my preliminary testimony, the lungs were wearing more than the usual weight. And I said at that time it's because due of the congestion. And therefore, and then at that time I was asked, I believe by you, whether the lungs were well aerated. And in my opinion, I said that the increased weight of the lung indicated they were not well aerated.
Actually, at the preliminary hearing, you indicated that congestion in the lung is people dying for any reason. It's a very common finding.
Yes.
That's what you said,
Yes,
right?
that's correct.
And so at the preliminary hearing, you said that the congestion in the lung wasn't a significant factor alone in relation to making a diagnosis of drowning, correct?
It was not alone a significant factor. That's correct.
You went on to say that pulmonary edema is fairly common in many causes of death.
That's correct.
And so at the preliminary hearing, you said that what tips the scale for you is the presence of large amounts of fluid in the stomach and in the airway, which cannot then be explained, right?
I think that during my preliminary hearing, I made a number of statements. Number one, that they could not have
Doctor,
been...
would you just turn to page 1451 in the preliminary hearing? I put it up there for you.
I'm sorry, where
Page,
is this it?
Yes, it's right there.
Right there in the bound volume.
page 51 of this stuff, of the grace?
1451. No, of the...
This
it's
one right
Dr.
here.
Perper, it's...
Dr. Perper. Dr. Perper, it's right here. This is bound volume.
Sorry.
It's all right. What page?
1451,
1551?
1451.
1451. Yes, I'm at 1451.
Okay, so right in the middle of the page, line 12, I asked you the question. So really, it's the stomach that tips the scale for you. And you answered the airway and the amount of, in other words, presence of large amounts of fluid in the stomach and in the airway, which cannot then be explained. That was your testimony at the preliminary hearing,
that's
right?
what I said.
And in order to make the assertion of how much water was found in Michelle's stomach, you had to rely on the testimony of the officers that reported Michelle throwing up. Correct?
This was my determination at that time, right?
Right. Well, even now, that's the only evidence that you have in relation to the amount of water that was thrown up, correct?
No, because as I mentioned in my previous testimony, there is evidence of dilution which I didn't discuss at the time when I offered my report, but I mentioned it
I
during...
understand. That wasn't my question, though. I'm talking about the evidence about water being thrown up.
The evidence of water being thrown out is exclusively from the evidence
officers.
which was supplied by the people who provided the resuscitation. That's correct.
And during the trial, we've heard testimony from Officer Motzinger that it was a lot of water. He doesn't know how much, but it was enough that it was able to go into his glove and down his leg and into his boot.
Yes, and there was also a tube, in other words, from the airway was drainage of the water. Yes.
And then Officer Ormond testified that there was a second incident where not as much as the first time came out, but he still thought that it was a lot, and he thought that Officer Ormond said that the first time he thought was 3 or 4 cups, and the second time was something less than that.
Yes, this is from the witness.
From the trial.
Correct.
Okay, and so this water bottle, this is 16.9 fluid ounces.
I don't know what
Those
it,
2 cups?
I'll have to look at different bottles.
may.
This is 500 milliliter.
Yes.
Yes, a cup of water is usually about 250 milliliters. Therefore, as I made in a previous calculation, 2 cups of water of 250 milliliter would be 1 liter of water. If there were additional 3 cups, would be additional 3/4 of a liter. And then I said one.
Herbert, I'll ask you another question and then I'll ask you to answer. Okay, can I have the water back, please? Can I have the water, please? Thank you. So, Dr. Perper, if somebody is just watching vomitus come out and it's coming out like this, fair to say that it's pretty hard to estimate exactly how much water is coming out?
Objection, speculation.
He may answer. Overruled.
Isn't that a fair statement?
Can you repeat your question?
Yeah, if somebody's just watching water come out, whether it's being poured or thrown up, isn't it fair to say that it's hard to just eyeball estimate how much water?
Well, I would think that somebody who is pouring water and they are approximately half a gallon of water, a person would say that's a significant amount of water pulling out of the particular container. Whether it would be exactly 3/4 of 1 3/4 of a liter, or would be 1 liter and 1/4, or be 3/4, I would agree with you. He could not precisely make the assessment without measuring. But that's an estimate of his. If his estimate is lower than that, then it's lower than that. If his estimate is higher than that, it's higher than that. If it's appropriate, it's appropriate. I have to rely my determination on what he said. He didn't say it was half a cup of water. He said it was a significant amount which he estimated.
That's right. My question was simply, it's really hard to estimate how much water is being thrown up. Isn't that a fair statement?
It's in general, but it depends on the person who is doing the estimate. Some people are more accurate, others are less.
Absolutely, fair statement. And even the amount that I poured out of this bottle was more than enough to constitute enough water to go into a glove, down a leg, into a boot, right?
As I told you, I'm not a specialist in this kind of estimates, and I don't know how good I would be.
Okay. In addition, well, let's see, before we move on, if I may approach.
You may.
Dr. Perper, I'm showing you what's been marked as Defendant's Exhibit DD. Do you recognize that?
Yes, this is a chest frontal view, which is from American Fork Hospital, and is dated 4/11/2007 at 12:40, and then it's, you want me to read what it is?
Yeah, in just a second. That's a chest x-ray of Michelle MacNeill, correct?
This is a chest x-ray, which I can read whatever is the comment. What do you want me to do with this one?
Wait for my question and answer my question. That's all I want you to do. Okay? And so in that chest x-ray, it's reported as a normal chest x-ray, correct?
Yes.
It reports no infiltrates in the chest, right?
Yes.
Doesn't report any abnormalities with the lungs, correct?
In this particular case, what it says in his diagnostic impression, it says a satisfactory endotracheal tube position. No evidence of acute disease, which means that an endotracheal tube, a tube was placed in the trachea, which is the windpipe, and That's all it says.
We'll look up.
No evidence of acute disease.
Yeah, it also says that there's no pneumothorax. No
It says no acute infiltrates
no acute
and no pneumothorax or no pleural effusion. Acute infiltrates usually refers to infiltrates which are usually of an inflammatory nature, like somebody has pneumonia or somebody has cancer, and they would see something which is whitish. That's the way it appears on the chest ray. If there is significant edema, they may diagnose edema. They may not diagnose edema.
They didn't diagnose edema.
The pneumothorax means that there is no air inside the chest wall which compresses the lung.
So that would be just a pneumothorax would be just outside of the lung, where a pocket of air would be compressing the lung. Correct?
Correct.
And so it doesn't diagnose a pneumothorax. It doesn't diagnose pulmonary edema. Correct?
No, it says it doesn't diagnose pulmonary edema. It doesn't negate pulmonary edema. It says there are no acute infiltrate. Acute infiltrates are focal concentration of acute inflammatory cells or cells of cancer.
Mayor, I'd move to offer the exhibit.
Any objection? DD is received.
Mayor, Coach?
You may.
It says no evidence of acute disease, too, right?
That's correct.
It also comments on the cardiomediastinal silhouette, too, correct?
I see, please.
And indicates that that appears normal.
The cardiomediastinal silhouette means that the shape of the heart and the shape of the middle area of the chest are normal. In this particular case, obviously, this chest ray, like many times, did not diagnose that there was some enlargement of the heart. Not very severe, but the heart weighed about, I believe, it was about 400 grams. So this is hypertrophy of the heart, is enlargement of the heart. This is not detected on the chest X-ray because chest X-ray many times are not able to diagnose more subtle pathological findings.
Chest X-rays, however, are able to pick up edema in the lungs.
Sometimes yes, and sometimes no. That's the true answer.
Okay. You also found in your examination and review of the autopsy that there was clinical evidence of hypertension that the Utah State Medical Examiner, Dr. Fricke, didn't identify. Isn't that correct?
I think she did not identify evidence of hypertension, which I identify in the kidney. In other words, she knew that the person has hypertension, and this hypertension, high blood pressure.
Dr. Perper, could I ask you another question and just ask you to answer them one at a time?
Please.
Okay. So in your review of the autopsy, you found evidence of clinical hypertension in Michelle MacNeill's kidney that Dr. Fricke did not elaborate on.
Correct.
Dr. Fricke did elaborate to some degree about hypertensive changes in the kidney, but you elaborated even further.
I do not, if you'd show me in her report that she identified some hypertensive pathology in the kidney, because I don't remember that at all. Thank you.
You have a
Yes, she said, the answer is yes. she said that the kidney is granular, but granular without any other explanation microscopically of the granularity, which on microscopic examination,
Dr. Perper,
yeah, she identified, yes, she identified the changes in the arteries, but she did not diagnose it in her diagnosis.
right. And so she, as I read the report, and she identified arterial sclerosis in the kidney.
She
Correct.
identified the changes, but she did not make a diagnosis of arterial sclerosis.
And you diagnosed arteriolosclerosis.
That's right. And the answer is that those are small arteries. That's why they are arterial.
Right.
So it's not arteriosclerosis, it's arteriolo, which means small artery, muscular arteries.
So, in short, you diagnosed more hypertensive changes in the kidney than Dr. Fricke did, correct?
No, I think that what she did, she basically diagnosed similar things to what I diagnosed, only she did not make the specific diagnosis of arteriolosclerosis. But her description mentioned that there was thickening and sclerosis of the small arteries.
At the preliminary hearing, you said, so again, the autopsy report missed what we call the arteriolosclerosis of the kidney. That's what you said at the preliminary.
That's correct.
Right, okay. And then again, you commented on the drugs at the preliminary hearing on page 1400 and said that in your opinion, within a reasonable degree of medical certainty, there's not sufficient certainty to consider them as a significant cause of death.
Correct.
Right? At the preliminary hearing, you also commented about your findings in relation to the liver, correct?
Correct.
And also commented that you felt that Dr. Fricke didn't identify the full extent of damage to the liver.
Correct.
And Dr. Fricke identified fatty liver disease, right?
Correct.
And you went on to find moderate to marked vacuolization. Did I say that right?
No.
No? Okay. Would you?
What I defined, I said that there was moderate to marked fatty change of the liver. There's the same fatty change of the liver which Dr. Fricke also identified. What Dr. Fricke did not identify was that some of the liver cells, their nuclei were vacuolated, which means that there was a kind of sugar, which we call it glycogen, which was inside the nucleus of the cells. And then it expands the substance of the nucleus to the periphery. So instead of having a blob of nucleus in the center, you have a ring of chromatin, of nuclear substance. And that's called vacuolization of the hepatic cell. It's a vacuolization of the nuclei, which sometimes is seen in diabetes, but it's not diagnostic for diabetes.
At any rate, wherever it came from, you observed it in the liver, right?
Sorry?
Whatever the cause, you found it pursuant to your microscopic examination of the liver slide.
That's correct.
The liver, like the heart, has some variability in relation to findings that may appear on various slides. Isn't that a fair
I'm
statement?
not sure that I understand your question.
Okay, so as I understood your direct testimony, you explained that when a medical examiner preserves tissue from the heart or the liver, it is preserved in wax. Is that correct?
Preserved in formalin.
And well, isn't that then put into paraffin wax, and so then slices are taken?
Well, what it's after it's put in formalin, it's taken out of the formalin, and it's passed through different alcoholic solution, which takes the water out, dehydrated, and after it is dehydrated, it's basically placed in a paraffin, which then solidifies, and they have a paraffin block. And this paraffin block is then cut with a special kind of knife, which is called a microtome, in very, very thin section. Those sections then are placed on water, on warm water, and then they are placed on the slide, stained, and then covered with a cover slip, and then examined under the microscope.
And so each time slides are created, there is that thin slice taken off of that sample that's preserved in the paraffin. Correct?
That's correct.
And so there is some variability in what is seen on those slides as different slices are taken and then examined by different medical examiners, correct?
Variability means difference between either two locations or it's in the same site. I'm not sure to which one you refer.
Okay. Let's use what's been talked about already. With the heart, myocarditis can be seen in some portions of the heart and not seen in other portions of the heart.
That's correct.
And so Dr. Gray testified yesterday, I think you heard, that there's some variability in between slides and in the number of blue dots that you may see on
There is
slides, right?
okay.
Isn't that correct?
If a person cuts a number of slides, like in this case, they will cut 4 sections of the slides from the heart. Mm-hmm. Okay. If somebody examines those kind of slides and it's myocarditis in one of them, then you can make a diagnosis of focal myocarditis in one section. But if there is no myocarditis in any one of those slides, then period, there is no myocarditis. In the 4 slides...
Dr. Perper, appreciate your explanation. The only point I'm trying to make is that as Dr. Gray testified, do you disagree with Dr. Gray's testimony that there can be differences in what is observed on different cuts?
There can be differences if there is differences. But
Right.
if there's no differences, there's no differences.
Right. So you did not review the same slides that Dr. Fricke reviewed, correct?
My understanding is that I reviewed the same slides.
Well, you reviewed slides that were cut and sent to you, right?
Okay, I understand what you're saying. If you are saying that I did not receive slides which were cut and show myocarditis, and I receive another set of slides which did not show myocarditis.
No, that's not what I'm asking. All I'm asking is that you were given your own set of slides, correct?
Those are not my sets of slides. They are original slides of the autopsy. My understanding is that I received the original slides of the autopsy. There is another possibility that I receive copies of the slides. What it means that the same block of paraffin from which the first very thin section was cut, an additional section is cut which is also extremely thin, and basically it's similar, almost identical, virtually identical. Whether there was here cut a set of microscopic slides which I didn't see and have myocarditis, and the block was cut much deeper so it doesn't correspond to the slide which I see, then I can say, show me the other slides and I'll examine them.
Dr. Perper, that's my only point, is that you don't know that you received the same slide that Dr. Fricke reviewed, correct?
My assumption is, my understanding is that I'll receive the same slides or a cut which basically is identical in morphology to the one which he didn't cut. If this assumption is not true, then my conclusion is not true.
Okay. And you don't know whether your assumption is true or not?
I don't have any reason to assume differently because I was not informed that's differently. But okay. I cannot exclude that this is a possibility.
And we got into that conversation because I was going to say the same thing is true of the liver as well, that there may be differences from slide to slide as the block of paraffin wax is cut. Isn't that a fair statement?
The answer is that theoretically yes, practically no.
Okay. At the preliminary hearing, you testified that the Utah medical examiner's opinion that Michelle MacNeill possibly died of a fatal arrhythmia due to hypertension can be reasonably accepted, correct?
As I said before in my direct, because of the focal scarring of the heart and because of the evidence of hypertension, I cannot either exclude, there is a possibility which I cannot either exclude or confirm.
Preliminary hearing, you just said yes to that
Well,
question.
it's the same thing. That's a possibility. I am just explaining that's what the possibility is. It may happen or it may not happen.
And if the preliminary hearing, you also said if she would have had no fluids in the airway and no fluids in the stomach upon resuscitation vomiting and just edema, you would not have made the determination of drowning.
Correct. If there would be no evidence of fluid such as you note, and would not be dilution of the blood, as I mentioned, then definitely I would make a diagnosis of drowning.
Dr. Perper, do you recall from the autopsy Dr. Fricke finding that Michelle MacNeill had a large amount of very firm stool in her colon?
I don't recall that, but assuming that's true, what would be the answer, the question?
And so that would mean that what we would call constipation, correct?
Well, it depends how hard is the stool. You know, I mean, normally, in a normal process, in a normal individual, in the colon, the stool is solid because all the water is absorbed. Now, if in this particular case the stool was stone hard and is in such description, then it's consistent with constipation. But finding feces, which is not the nicest thing in the world to find, but they are there in the colon, that's seen in virtually every autopsy which the person didn't have diarrhea.
Isn't it fair to say that a notation in an autopsy of a large amount of firm stool would be a typical way for a medical examiner to identify constipation?
No,
No?
it's
Okay.
not.
Fair to say that if someone is constipated, that drinking water is one thing that is appropriate to do to try and enhance your ability to have a bowel movement?
If somebody is constipated, it depends on the degrees of constipation.
Okay.
There are constipation which are fairly physiologic. Almost every person at one time in his life may be constipated. There are constipation which are pathologically. The treatment of constipation is different. People who are physiologically constipated, and there was no evidence in Michelle that she had any pathology to account for constipation. There are all kinds of pills which soften the stools or enhance the motility of the intestine, so the constipation is cured or addressed.
Michelle had been taking oxycodone since the day of her surgery. Oxycodone has a side effect of constipation, does
Yes,
it not?
opiates usually tend to cause constipation. That's correct.
At the preliminary hearing on page 1491, if you want to review it.
Was point 1491?
1491, yeah. You indicated that the levels of medication in the toxicology report were small.
1491. Which line do you refer to?
So line 4, I asked you the question, and in your review of the toxicology report done by Dr. Fricke, you found that the levels that were we were talking about toxicology, were small within a
Yes.
therapeutic range, right?
Yes, I said that.
And that's consistent with what you put in the report, too,
Yes, correct.
right? And then we did talk to some degree at the preliminary hearing about this dilution discussion that we've had today as well, correct?
Yes.
And if you turn to page 1476,
76.
1476.
Okay.
So starting on line 3, I asked you the question, okay, and all I'm asking you to do right now is point out any values that you believe are consistent with dilution. And we were referring to the same exhibit, which was the lab report, right?
Yes.
And your answer was, there are no value except for the value of which I discussed of sodium.
Yes.
However, as I said before, this is not the initial screen. This is the screen after treatment,
Yes.
right? That's what you said?
Yes.
And then I asked you, so did I understand your testimony right, that only sodium on defendant's exhibit number 1 is consistent with, and you said right, and I finished up with dilution,
Yes.
and then you said right, because the calcium is elevated at 12.3 as high when initially it was 2.4
Right.
active.
Correct.
That's what you said at the preliminary hearing, right?
Yes.
Dr. Perper, isn't it accurate to say that when somebody dies, there are fairly rapid changes to their blood?
Well, it depends. When somebody dies, there are changes in the blood, and their kinetics, their rapidity, depends on a variety of factors. Okay. For example,
Hey, I think you've answered the
going.
question.
Sorry. What?
You may.
Is that all right if I set up the easel?
Yeah, go ahead. Yep.
I'm not a great artist, and I'm not a doctor either, so I'm sure you can correct me. So if this represents a blood vessel, an artery, inside the artery, in a person who's alive, there are lots of cells, correct?
Yes, there are a lot of cells. There are also all kinds of substances, chemical in dilution.
Right. And so inside cells, potassium levels are high and sodium levels are low, correct?
Correct.
So K stands for potassium, Na for sodium, right?
And so
I'm sorry,
it's okay. I can see from
can
here.
you see? Okay. I don't mean to make this hard.
Yes.
It's not a good way to do it. So K is the typical symbol for potassium, right?
That's correct.
And Na is a typical symbol for sodium, scientifically. And outside of the cell, in the other plasma, or whatever you
Yes.
refer to the fluid, then the sodium level is very high, and potassium is low.
Well, it is the cell.
High as compared to
Sorry. The sodium, the potassium is lower in the outside, in the plasma, in the liquid component of the blood, that it's in the red blood cell. That's correct.
And in order to keep the potassium and other contents inside the cell, the body needs to have energy, right, or be alive.
What happened is, yes, there is a cell, there is a membrane which covers this
Right.
thing. This membrane is a semi-permeable membrane, which there is a mechanism by which the cell, the living cell, is doing that. The red blood cells are very particular because they don't have a nucleus. Their function is not like the function of any other cell in the body. Every other cell in the body has a nucleus. Red blood cells don't have a nucleus. They are little sacs which contain sodium and potassium, and indeed in this little sac there is more sodium than potassium. Now what happened in the drowning...
Okay, I think you've answered my question, and so now let me ask another one. And so when a person dies, the energy necessary to keep the contents inside the cell goes away.
Right,
Right?
correct.
And so then the high amount of potassium, which is inside the cell, enters the plasma part of the blood, correct?
Yes, potassium leaks out of the red blood cells into the blood, yes.
Which then causes the potassium to rise.
Increase. But that's
And
right. But this is an element which is time dependent, because when this happens, also the red blood cell disintegrate. That's what we call hemolysis. It breaks up.
And hemolysis happens quite quickly, correct?
Hemolysis can happen fairly quickly at a variable. We take many times blood from people which are dead for 1 day.
Yeah.
Or 2 days. But in people which we found out from 1 day, as a matter of fact, we don't see hemolysis. But in some people we do. But usually, the earlier the time interval, the less the likelihood of hemolysis, unless water enters in the system and then red blood cell break up.
Dr. Perper, even without water entering the system, there's lots of literature out there to indicate that even within 15 minutes of death, hemolysis...
No, there's no significant hemolysis usually within 15 minutes of death, because in many cases in which I took blood from the heart or blood peripherally, the blood was not hemolytic. In other words, there was the component of the blood when you spin it which was free
Dr.
of...
Perper, you even said in your report that you can't make conclusions in relation to potassium in the blood because hemolysis occurs very quickly. Isn't that correct?
In this particular case in particular is drowning. It's water entering here, and therefore this...
That's not what you said in your report, though.
The same thing. It is drowning. In drowning, there's additional fast hemolysis.
And I'm going to ask you about drowning, but in your report, you didn't say that because of hemolysis due to drowning that you can't make conclusions about potassium. You said you can't make conclusions about potassium because it's unreliable due to hemolysis, period.
Yes.
That's what you said in your report. Okay, now let's talk about drowning. And so when somebody drowns and there's some amount of water that may enter the bloodstream, that further accelerates the breakdown of the membrane around the cells, causing potassium to leak out into the plasma, correct?
The red blood cells remain intact in the blood because it's what's called an osmotic balance, in which the blood is salty and therefore keeps those cells intact. If you add water, if there is hemodilution, then those cells can break apart, and therefore the potassium is released.
Right. On this lab report, which is Exhibit AA, the sample that was tested clearly shows that it was a hemolyzed sample, correct?
Yes.
In fact, it says that it was 4+
Right.
hemolyzed, which is the maximum on their scale,
Yes.
right? And so the lab values that are reflected there are taken from blood, which has already been hemolyzed to at least the highest degree that
Yeah.
that they measure on that scale,
But I
right?
believe blood was taken on 2 occasions. I don't know if on both occasions was hemolyzed, but at 4+, yes, it would be hemolyzed.
And on the lab results, we don't know when that sample was taken, whether it was soon after she arrived at the ER or whether it was after she was pronounced dead, do we?
I think that there's a time when the blood was taken, like 12:48, and then it's another one about 1:30. So there are times.
Yeah, and Dr. Van Wagener has testified in this case. He doesn't know when the sample was taken.
Well, if the time on the time of the test don't reflect the time when actually the blood was given, then you can make a determination. That's correct.
And the timing of the drawing of the blood makes a big difference in relation to evaluating the significance of the numbers, correct?
Yes. As I said in my initial report, the potassium was very high, but because of the hemolysis, I cannot make a determination
Right.
whether it was significantly high in terms of administration of potassium.
On the lab report that you have in front of you, it shows that the liver enzymes are very high, correct?
That what?
The liver enzymes, AST and ALT.
Postmortem liver enzyme
Okay, let me ask a better question.
don't have. I wouldn't make any kind of conclusion or reference because cells break up, liver cell in particular, and those enzymes are released. So I cannot say anything about the significance of postmortem liver enzyme.
Right, I mean, postmortem blood evaluation generally is fraught with problems, isn't it?
Well, it depends on the elements. There's some elements which disintegrate like potassium. The other elements as protein which do not.
Okay. Dr. Perper, typically it's fair to say that there are no autopsy signs that are conclusive of drowning. Isn't that a fair statement?
There are no autopsy. In other words, beside the dilution factor which I discussed.
No, even including the dilution factor.
No, I disagree. In a case like that, in which the death was occurs shortly, in other words, the person was found shortly after she died, in which I have those point of references before and after in regard to substances which stay in the blood and they were diluted more than 20%, I think yes. If you ask if there are additional signs of drowning which can be used for the determination of drowning, the answer is yes. They were not used in this particular case.
So today you're saying that that it's the dilution that is what tipped the scale for you to make a conclusion of drowning?
No, I don't say that. I said that both the findings at the time of the resuscitation of the body, plus the dilution factors which I discussed before, of elements which don't break up, such as the red blood cell, such as the protein, the albumin, the platelets, those did not break up. Those elements indicate that there was significant dilution, which is not explained by anything else than by drowning after considering the infusion of therapeutic fluids. There are other tests to determine drowning. As I said, they were not done in this particular case.
Okay. And in addition to dying, which causes hemolysis, and drowning, which causes hemolysis, there are also illnesses that can cause hemolysis as well, correct?
There are what?
Illnesses, viruses,
Yes.
and you don't know whether Michelle was sick or not with some sort of an illness which also could have caused hemolysis, do you?
And this would be absolutely sheer speculation,
Right.
because the clinical records do not indicate any evidence of hemolysis. The medical records do not indicate, the autopsy finding do not indicate any evidence of bleeding. They do not indicate any evidence of recent bleeding, recent or old bleeding. They don't indicate changes in the spleen, which are seen when there is chronic hemolysis. So there is absolutely not evidence of hemolysis in vivo in this person.
To a significant degree.
I'm sorry?
If the hemolysis was in a smaller degree that didn't lead to bleeding, then you wouldn't know whether there was evidence of that or not, right?
I cannot speculate on something which is not present.
That's my point. And you testified at the preliminary hearing as well as in your report that while there could be some variability, it is your belief that Michelle passed away within an hour of when she arrived at the hospital, correct?
If you remember in my preliminary hearing, I said
exactly.
that most likely is an hour, but I cannot exclude the possibility that there are 2 hours, 2.5 hours.
I understand, but you said that it's your belief that it was within an hour, correct?
It's usually within an hour, considering all the elements which I mentioned that they have to be
Right.
considered when there is a drop in the temperature after death.
Can I push on her?
You may.
I'm showing you what's been marked as exhibits BB and CC.
Yes,
These are prior medical records
yes.
for Michelle MacNeill, and I've highlighted temperatures. The first is from when she had cervical spine surgery in 2003. I believe you testified about some lab results in relation to that.
Yeah.
And would you
The
just...
temperature in 2003, which you outlined in yellow, is 36.2.
And just, would you just identify the temperatures and go through page by page? So we have...
Okay, this is on January 23, 03 is in yellow, the temperature noted 36.2. On 22nd, it's in handwriting, the 22nd of 2003, it's 36.2. I have a problem because it says springtime. I would assume that the date here is January 22nd, 2001, because it's at the bottom on the right.
Okay.
If this would be January 22nd, 2001, then the temperature is basically is 36. So the variability between those three is between 36 and 36.2.
Okay.
And then on, again appears to be January 22nd, 2001, at a different time, at 13 hours, it's 36.3. Then on the same day, at 04 hours, is 36. Then on still January 22nd, at 11:40, it's 35.5.
And that temperature is even less than her temperature was when she was checked at American Fork Hospital, correct?
Yes.
Okay, so keep going.
And then again on January 22nd, 2001 is 36.2 at 20 hours, which is at 8 o'clock in the evening.
Okay. And then if you turn to the next exhibit, I forgot the...
CC, I think.
These are records from Michelle's plastic surgery in April of 07. You see the highlighted temperatures that were measured in those records?
This is, it says 4/04/2007.
Yes.
And the temperature at that time is 98.2, and I have a problem, and just a moment, see if I can do that. 98.2 would be much higher than 96.8, because 96.8 was 36 degrees Celsius. And 98.2, I cannot tell you. I'll have to look to see exactly what's the temperature. 98.2 is in Fahrenheit.
Yes,
and
36.8?
It's how much?
36.8? Does that sound right?
If you made a calculation, a calculator, I yes.
Okay.
Yes.
So,
So the temperature varies, and, oh, you want to go? Which one is that? This one?
Yeah, go ahead. Do you need to see this?
And then on, this is, again on 4/4, not clear the time, it's another temperature which is 98, and before it was 98.2. And then on, again 4/4/2007 is 96.6.
The 96.6 would convert,
on
Dr. Purple?
I'm sorry?
96.6 would be equal to 35.9,
Yes.
correct?
And then on 403 is 96.4.
Which is 35.8.
Yes.
Okay.
And now on, again, 40307 at time at 19 hours is 96.8.
Which is 36.
And then it's 96 at again 40307 at 9:30 and a half an hour
So it's
later.
at 9:30, it's 96.0, correct?
Right,
And that's
half an hour later.
35.55 or 35.6, right?
And
so, Dr. Purple, before you move on, and so that
Yeah.
temperature is actually even less, again, than
Right.
what Michelle's body temperature
But
was
what
at
I-
the American
correct.
Emergency Room.
But temperature of an individual varies during the day, varies during the night, and varies according to the condition. So,
I understand, just keep,
no. So what I'm saying, in order to fully evaluate, I would have to see the temperature when she is totally normal during a normal visit, and then in the hospital, different condition of her can affect her temperature.
okay. So the next temperature,
Then the next temperature on 40307 is at 20:30, which is 8:30 p.m., is 96.2.
or 35.7,
Yes,
which is what her temperature was at the American Fourth Emergency Room on April
Right.
11th, correct?
Right.
And, we moved to admit exhibits BB and CC.
No objection.
BB, CC are received.
Dr. Purper, isn't it fair to say that as far as the baseline goes, that Michelle's temperature tends to be lower than 36.6?
yes.
And so her temperature drop, most likely when she arrived at the emergency room, was actually probably Not very much at all
Well,
from her baseline, correct?
Except that at the time when she was examined in the hospital, was post-mortem lividity clearly observed on the back and on the arms, and this, under no circumstances, happens in half an hour or an hour.
So,
So it's a discrepancy between those. But remember what I said in regard to the temperature, that it depends on the variety of environmental condition. So if she was in the water, and the water was warmer, then it would warm her body be above her normal temperature. So what I'm saying is you have to take in consideration both the drop in the temperature and both the postmortem lividity. Postmortem lividity doesn't appear to this extent in half an hour.
you don't know what extent it appeared to, do you?
I'm sorry?
You don't know what extent postmortem lividity appeared, do you? You weren't there.
Is a range of postmortem lividity. I know
That's
that
my point,
postmortem
Dr.
lividity,
You don't know what the range of postmortem lividity was, correct?
I know that, yes, well, I know that the postmortem lividity was present at the time when she arrived at the hospital.
Dr. Van Wagner testified in this case that he doesn't know when he observed postmortem lividity, whether it was when she arrived or when it was later. He doesn't recall. All he recalls is that he noted it.
That's correct. What I'm
So,
saying is that at the time
You're
of
again
the,
making assumptions, correct?
Objection, argumentative.
Overruled.
I would like to
I'm
answer.
sorry. Ask the question again.
You're again making assumptions about the evidence based upon what you think it is.
No, I don't make any assumption in this time. What I'm saying is the following. There's no assumption.
Okay.
There's a statement in the hospital that there was postmortem lividity on the back and on the arms. Now, my knowledge of postmortem lividity is,
Prosecution can ask you about your knowledge if you want. The statement in the record is that postmortem lividity was observed at some point based upon Dr. Van Wagner's notes that he wrote up after the incident with Michelle was done. And he doesn't know when he first observed it.
what he knows or doesn't know, I don't know.
And nobody else observed postmortem lividity in this case, correct? Paramedics didn't?
And nobody else denied its presence.
Paramedics denied its presence.
I don't think that there's a denial.
I'm sorry, what's your objection?
Assumes facts not in the record.
Didn't a
I specifically
paramedic
asked them, and they said
Yep.
they didn't see it.
overruled?
It's not a denial,
Not seeing it versus
denying that it's...
Overruled. Overruled.
Do you recall writing an article titled Time of Death and Changes After Death?
Yes?
And do you recall stating in your own article that postmortem lividity may be evident as early as 25 minutes after death?
Yes?
Isn't that inconsistent with what you just testified to here today?
As I said that it cannot be within half an hour, it cannot be within 20. In my experience, most of the time is not only 25 minutes. In the article, yes, I said it could be under 25 minutes.
You said postmortem lividity may be evident as early as 25 minutes after death.
Yes, it can be evident, but I don't say where and how extensive.
And you don't know where and how extensive, well, I guess you know where, but you don't know how extensive it is in this case,
I
correct?
know because it says on the back and on the arm, so it's pretty extensive.
Dr. Perper, in your report, you also took some issue with the autopsy in relation to the injury or the incision on the right part of Michelle's head. Is that correct?
I said that the incision and the injury to the head, I could not distinguish between them and any other kind of inflicted injury, and I said that they are consistent with bleeding coming from the surgery.
May I approach, Your Honor?
You may.
I'm showing you what's been admitted as State's Exhibit 10. And that's the incision at the right part of Michelle's head, correct?
Well, I am not sure that this is an incision. This is an area on the, because I have to judge them on the photograph.
Okay. Well, the plastic surgeon has already testified in this case that that was a surgical incision.
Oh, and it's a surgical incision, because from the photograph what you see, it's an area of a scab which is dark, it's surrounded by some bleeding. So if he said he made an incision there, that's an incision there.
And in your report, you said that that you cannot determine whether that was a result of a blow or secondary to a fall into the bathtub, correct?
Yes.
So fair to say that that if someone fell into the bathtub and hit their head on that incision, it could cause bleeding, correct?
No, there are two things. Two things happen. If this is an incision, which is a surgical incision, that's the end of it. It's a surgical incision done by a doctor, doesn't have any way to do with the trauma. At the time when I wrote that, I did not know that, so I said it can be not necessarily an incision made by a knife, because you cannot say this from this particular photograph. It looks that it might be a laceration, a splitting of the skin. It could be from a fall, or it could be from something during the surgery, and I was unable to say which is which.
Okay. Dr. Perper, at the preliminary hearing, again, on another page, you indicated that the drugs in Michelle's system, in your opinion, were not a significant contributory cause of death, and you doubt they could have caused some kind of impairment, either in motility or in, it was inaudible.
I remember saying in some place that in my opinion they are not a cause of death, but they might play some role.
Right. You also said, and we've talked about that on another page in the preliminary hearing today. On page 1494, you said that you doubt the drugs, could have caused some kind of impairment, either in motility or in inaudible. That's what you said at the
because
preliminary hearing.
Because in the therapeutic, yes, that's what I said in my opinion.
And at the time that you made that statement, we all believed that the Phenergan level was approximately 0.1, correct?
The what?
The Phenergan, or promethazine, sorry?
Yes.
We believed at that time that the promethazine was approximately 0.1.
Right.
Now we know that it was just detected in some unknown amount.
Right.
Correct? So based upon what we know now, the medications from the toxicology report, at least in relation to promethazine, may have been less.
Yeah, but remember what I said both during the preliminary hearing, and I said now that I do not know what are the true concentration of the drugs, because I was, I believe, even asked about that. And I said, because of the dilution, I don't know what were the actual concentration, and because I don't know the initial level, I cannot say how much it was the dilution.
And I understand that. It's a fair statement. And so Michelle's blood, it was diluted to some degree.
They were diluted.
What percentage?
Well, there was diluted. Well, I know that it was diluted to a significant degree because if you remember during my direct examination, what I said about the 20% which should have been diluted and the excess dilution which was 50% or higher.
Yeah, go ahead.
And so if her blood was diluted, let's say 50%.
Yes.
If the blood was diluted 50%, it'd be unlikely that we would actually get lab results that came back from the machine, wouldn't it?
Some blood results, in other words, the dilution of the different elements was not the same. For example, for hemoglobin was 33%. For the protein was 50%. For the thrombocytes was about 80%. Okay, so there was. What I can say is there was significant dilution beyond the amount which was therapeutically given to her.
But you can't just take the differences and make a percentage on dilution because hemolysis also affects just hemolysis from dying affects the blood as well.
The hemolysis affects the blood, but it doesn't affect the protein because the protein don't get broken down.
Protein is something that is necessary in wound healing, such as after you've had plastic surgery, correct?
Protein is a substance which is necessary to be in your blood, and basically it reflects the state of your nutrition.
Right. And so if somebody hasn't been eating much after plastic surgery, for example, protein levels could go down.
Not, but if there would have been a decrease in protein from 4 grams per cent to 2 grams per cent in 8 days, there would be significant clinical manifestation of those. There might be edema, there might be a lot of things.
Lack of wound healing, for example.
No, the wound wouldn't have nothing to do. The wound healing wouldn't drop the protein in the blood, no.
If you don't have proper protein, isn't it fair to say that wounds don't heal?
If you'd be to be severely malnourished in order to have an impairment of the repair of wound, which she wasn't.
You look at page 2 on the exhibit in relation to the AST and the ALT.
Again,
they tested the liver enzymes once, and then they diluted the blood to reconfirm it.
I told you the AST and the ALT, I cannot make any judgment, dilution.
That's not my question, Dr. Cooper. My question is that they were able to then dilute the blood again to retest the ALT and the AST, correct?
Yes, so what?
Okay. So they were able to dilute it again. So if the blood, let's go with your numbers, is 50% diluted.
Yes.
Now you have to factor in post-mortem redistribution, correct?
No.
Okay. In relation to, that was a bad question. So in relation to the medications that were found in Michelle's blood, oxycodone, zolpidem, diazepam, and promethazine. Okay? If you were to try and make any conclusions based upon the postmortem heart sample and consider whether they could be higher or not, something that you indicated you don't know because you don't have a baseline, but if you were to try, you'd also have to think about postmortem redistribution as well, correct?
No, it's not correct what you say. Your questions are so complicated that I have to address them by explanation. I cannot say yes or no.
Okay. You testified at the preliminary hearing that you understand the principle of postmortem redistribution.
Yes.
Correct? And you testified at the preliminary hearing that postmortem redistribution could occur within the 25-hour period of time, at least when she was pronounced dead, at the hospital at 1:03 and 2:15 when the autopsy occurred, correct?
Okay.
And you're aware that there are various, what are referred to as central to peripheral ratios that are used in discussing postmortem redistribution. correct?
But in order for me to answer this thing, I have to.
Okay,
Let me just give you an
I'm
explanation.
trying to ask you a simple question at a time, Dr. Perper, because I understand I ask bad questions sometimes, and I apologize for that. And if you just answer my simple questions, then hopefully I'll get to the point.
Okay.
Okay? So you understand that there are central to peripheral ratios have been measured in relation to all four of the medications that were found on the toxicology report conducted by the Utah Medical Examiner.
Yes.
Correct? And at the preliminary hearing, you testify that you're not a toxicologist and you don't know those ratios, correct?
That's correct.
But you were here in court yesterday and heard Dr. Gray testify, correct?
Yes.
And he testified about some of the ratios, correct?
Yes.
And so oxycodone, for example, he said could have a ratio as high as 6,
Yes.
correct? And so if we use a high end, and admitting I'm a defense attorney, I use high ends, this the high end ratio of 6 would have a much greater effect in evaluating the possibilities of the toxicology report values than a 0.5 factor for dilution.
Yes, that's true, except when you forget about the drowning and about the dilution, because
That's what I was trying to...
well, I'm asking you this particular question.
Okay, I asked the questions. I didn't intend to forget about drowning. I understood that we were using a high number, again, of potential 50% dilution, potentially from drowning, potentially from resuscitative fluids, right? And so if we were to attempt an unreliable process, generally, of looking at postmortem heart blood toxicological results, the potential factors for postmortem redistribution are way higher than the potential factors for dilution.
No, I disagree.
Why?
Well, I disagree because you have two processes which work at odds here. One is the process of dilution, which decreases the amount of real concentration of the component in the blood. You have then the redistribution, which only applies basically to the relation between the heart and the blood which is taken from the heart. So in redistribution, it means that the original concentration of the blood inside the heart is lower, in fact, and as a result of the distribution, some of it is leaked from the muscle of the heart in the blood of the heart. So therefore, you get an increase in the concentration of oxycodone in this particular case. But this effect is countered by the process of dilution, which dilutes the thing. Now, your statement that the dilution is less than the distribution doesn't have any grounds of proof or evidence.
If the blood was diluted, it would have been diluted contemporaneous with drowning, correct?
Correct?
Because if her heart wasn't pumping, there's no way that blood possibly could have entered from her lungs into the bloodstream, correct?
The dilution occurred when her blood was pumping.
Correct.
That's correct. The dilution...
Just tell me yes
But
or no. if I ask
your
you a
question is not a clear question. I'm sorry.
Okay. If the heart isn't pumping, water could not enter the bloodstream and dilute the blood.
If the blood
Yes
is
or
not...
no?
Yes. If the blood is not pumping,
You've
then...
answered my question. I'm going to ask you another one. And so postmortem redistribution is a phenomenon that would then occur after any sort of dilution has already taken place.
Yes.
And postmortem redistribution occurs because of drugs which are stored in the tissue, heart tissue,
In the heart
lung
tissue. Not in the lung tissue, in the heart tissue.
Well, postmortem redistribution occurs from the heart tissue as well, right?
the measurement is done from the blood. You don't take blood from the lungs.
Of course not. Postmortem redistribution also occurs because of drugs that are stored in the lung tissue that also leach out.
It
and
can
migrate
be, yes,
circulate
it
to the
can
heart,
happen,
right?
yes.
And so you've got all the tissue that's around the heart that factors into the postmortem redistribution analysis, right?
Can have postmortem redistribution. If the blood is taken from the heart, then the postmortem redistribution is effective from the heart and not from the lung.
I
If you take,
understand that we're not taking blood from the lungs. My only point, doctor, is that the drugs that are inside the tissue would not be contemporaneously diluted by any amount of water that entered the bloodstream while a person was alive. Right?
no, that's not true. When
I'm not talking about the blood. I'm talking about any drugs that are in the tissue.
when you take drugs, there's a distribution of the drugs, and this is called the volume of distribution.
Right.
There's a distribution, in other words, when you inject or you eat a certain drug. This drug is absorbed in the blood.
Right.
In some drugs, they remain in the blood. They are called to have a small volume of distribution. There are drugs which go out from the blood inside the tissue, such as the oxidant. Those are the drugs which have a large volume of distribution. The drugs which have a large volume of distribution, like the oxycodone, enter the tissue, like in the heart, and post-mortem they can leak inside back in the blood of the heart.
Exactly. I'll move on. Dr. Perper, referring back to the lab result, the lab test that was exhibit. This one.
Yes?
There's also a value there for lymphocytes.
For what?
Lymphocytes?
I'm sorry, I don't understand.
There's a value on the labs for the lymphocytes in Michelle's blood.
Yes.
And we talked about that at the preliminary hearing as well, correct? And on the report, it shows that her lymphocytes increased from 2.6 to 6.2.
Yes.
Correct? And that increase in the lymphocytes, you indicated, can occur from viral infections of some nature, correct?
Some of them, they can also increase in number of lymphocytes have been reported in near drowning, so they can be associated with drowning. And as a matter of fact, the literature says that the increase in the lymphocyte during drowning, and especially in near drowning, is a bad prognostic factor for kidney disease.
You didn't say that at the preliminary hearing, did you?
No, I didn't.
Yeah, in fact, you just said that there would be viral infections of a different nature, right?
Yes, viral infection can do that, except that there was no viral infection.
Well, you don't know that, do you?
Yes, I know that.
Okay.
Because there is no evidence in pathology of any viral infection or clinical evidence of viral infection.
At the preliminary hearing, you also said that, in your opinion, she died primarily of drowning with natural death, with some natural death contributing, but no way, no possibility of determining this really within a reasonable degree of medical certainty. That's what you said, right?
That's right. That she died of drowning, as I said before today, that there might have been an arrhythmia, but I cannot determine whether it was or not, and that's what this sentence says.
Right. And that's consistent with what you put in your report as well, correct?
And this is what?
That's consistent. What you testified to at the preliminary hearing is consistent with your report. And in your report, you said that it's your professional opinion that a, quote, terminal cardiac arrhythmia secondary to hypertensive cardiovascular disease could have been a contributory factor in the cause of death.
Yes, that's what I said. It's a possibility, as I said.
Okay. May I have just one moment, Your Honor?
You may.
That's all the questions I have.
You may redirect.
Excuse me.
I believe I offered all of the exhibits and for receipt, so.
Go ahead.
Dr. Perper, we've talked about possibilities here and the possibility of an arrhythmia. What is the difference of between what could have happened and what happened?
Well, what happened is a fact. What the person believes that it happened is a belief. If the fact is proven, that's the truth, that's reality. If a person has a belief that it might be reality, if it corresponds to reality, or it may not.
And as a scientist, you operate under a reasonable degree of medical certainty, correct?
That's correct.
You were asked to refer to your preliminary hearing transcript testimony with respect to comments about sodium and the changes of level in sodium. If I can have you refer to the preliminary hearing transcript, Doctor, to pages 1455. If I could just have you read to yourself pages 1455.
Yeah, I'm just going. Yes, I'm on page 1455.
If you could just take a minute and read pages 1455 through 1458. If you could just read those to yourself, and then I'll have a questions for you in just a moment.
Okay, I read page 1455 and 1456.
Would you read 1457 and 1458 also?
Yes, I read that.
The context of this testimony is talking about the effects of drowning and the absorption of water into the bloodstream, correct?
Correct.
And the diluting effect on chemicals within the system, within the body,
Correct.
in the blood. And is it true that in addition to sodium, you also talked about potassium?
Correct.
Is it true that you also talked about magnesium,
Yes.
calcium,
Yes.
and also indicated that there are a lot of chemicals which are vital to the maintenance of life that are diluted in a drowning case.
Correct.
That was addressed at the preliminary hearing.
Yes.
Thank you. We've talked a little bit about the body temperature following death. Would you just again explain what variables or what factors will affect the drop in temperature after death?
Objection asked and answered.
It's sustained.
Is it also true that drug use prior to death can also affect body temperature?
Yes.
And you testify that body temperature varies throughout the time of day for an individual.
I'm sorry?
And you also testify that the body temperature of an individual varies throughout the day.
Yes, that's what we call diurnal and also nocturnal changes, yes.
Okay. You were asked a question about whether or not the paramedics observed lividity, or law enforcement observed lividity on Michelle at the house in Pleasant Grove before getting to the hospital.
Yes.
What is your recollection of the testimony from the paramedics?
Objection, Your Honor. Foundation.
Sustained. If you'd like to present him with what they said, that would be fine, but I don't think he should be called on to remember the entire trial. Go ahead.
Is it your understanding that the testimony from the paramedics with respect to lividity observed on Michelle was that they did not look for it?
It was not
Objection,
reported.
Your Honor. I think that that's a misstatement of the facts that are in evidence.
And
This goes to the issue of did they look for it, was it a denial? I'll allow it. You may clarify. Go ahead.
Are you aware of whether the paramedics denied seeing lividity on Michelle at the house before going to the hospital?
Objection, Foundation, because there's no evidence that he was here and heard their testimony.
I assume he's been watching. Is that true?
Did you observe the testimony of the paramedics in this trial on TV?
Yes.
Okay.
Overruled. Go ahead.
Was there testimony from the paramedics that they denied looking for lividity?
I didn't listen to any denial, such denial.
Okay. But there is evidence that lividity was observed on Michelle at the ER, at the emergency room, correct?
That's correct.
And where was that lividity observed?
It was observed on the back and part of the extremities.
And what does that mean? What's the significance of that, doctor?
It means that there was significant lividity observed at that time, and therefore the person was dead for some time.
And how does lividity present?
Lividity presents as discoloration of the skin, which is somewhere between purplish and pinkish, more toward the purplish, and it's present on the dependent area of the body. In other words, on the part of the body which was facing the ground, because it's due to migration of blood by gravitational forces to the lower parts of the body in the small blood vessel or capillaries of the skin.
Is it your testimony that if someone performs effective CPR on an individual that's drowned, that individual is going to vomit water?
Vomiting means an active action by the person. In other words, in order to vomit, a person has to be alive. A dead person doesn't vomit. However, if you compress the chest, like in this case of a person, and you compress the chest, and in the process also the stomach, because the stomach is partly in the upper part of the chest, you can get regurgitation of fluid of fluid in which the individual was drowned, both from the stomach and from the mouth and the nostril. But this is not vomiting. Vomiting is a vital action of a human body.
Will that regurgitation necessarily happen immediately upon performing chest compressions, or might there be a delay?
If you don't know, if you don't, the person is not alive, so he cannot vomit. So his stomach and his upper airway, except for the blood, for the water which he already inhaled, is there like in a container, like in a rubber bottle. So in a rubber bottle, if you keep it and you don't press on it, there's no going to come up any water. If you compress it, obviously you are going to expel water, and that's what happened when you compress the chest of a person who has water in the stomach and in the airways.
Okay. It's your testimony. You testified earlier that it is your opinion, excuse me, well beyond a medical degree of certainty that Michelle MacNeill drowned. Is
Yes,
that
that's
correct?
my opinion.
Well
Within
beyond.
a reasonable degree of reasonable certainty and beyond, yes.
And beyond. Thank you.
Do you have recross?
In your report, you described the vomiting as possibly a terminal agonal event, correct?
Yes.
Okay. And that would mean that that there was some metabolic function still going on in order to vomit, and that was the last.
No metabolic function. The person has to be alive.
Right.
It doesn't have in other words, has to have reflexes,
Right.
which are living reflexes in order for him to vomit. And at the time when I wrote my report, and that's what I think it's even implied in my report, I wasn't sure whether this was compression or whether there was, because they say gurgling, and gurgling was not a clear test, so I did not know whether it's actual vomiting or it's compression.
Right. And what you understood at the time led you to believe that it's possible that that could have been a terminal agonal event.
Yes, if she would have been alive, it would have been an agonal event, yes.
And you made that opinion at a time that you knew that they were doing CPR.
Yes.
Correct.
Yes.
And one thing that has not changed, both from the time of your report and preliminary hearing and here today, is that when you consider all of the circumstances of this case, you still conclude that the manner of Michelle MacNeill's death is undetermined.
Yes, for the reason which I explained them in detail, yes.
Right. Thank you.
One last question, Your Honor. So, Doctor, the regurgitation of the water here was due to compression, in your opinion?
That's my opinion, yes.
Thank you.
Anything else?
No.
Do you have questions for this witness? Pass them to the end of the row, please. Counsel, will you approach the bench? Just a couple of questions for you. Would the use of CNS depressant drugs raise or lower body temperature if you know?
I'm sorry, I didn't understand the question.
Would a person using CNS depressants have his or her body temperature go up or go down if you know?
If they CNS depression,
If a person ingests a CNS depressant drug, does it raise or lower body temperature if you know?
I don't think it's a mathematical answer. It depends on the drug. Some drugs can cause death and others might not. So unless you know you're speaking about a specific drug, you cannot say that. I at least don't have the information. I would have to see what is the specific drug and then to check whether there's such a reported drop in temperature for the particular drug. If the person is in shock, it might be a decrease in temperature if there's an overdose of the drug. But if the drug is in therapeutic doses, my opinion would be that there would be no significant decrease in the blood temperature, in the body temperature.
The second question, could the dilution of blood be explained by a natural filling of the airway with water, not from inhalation, and then subsequent resuscitation efforts?
There's not. The question is unclear because there is no natural flooding of water in the airway. What happens in the airway, you can have, as most people know, they can have mucus. If there's mucus in the airway, particularly if it's thick mucus, it can interfere with the breathing or it may prompt coughing. But there's no natural installation of water in the airways, and there's no therapy. There might be if people have a bronchoscopy, which is an examination of the airway through an instrument, they may lubricate it, but they are not going to instill any significant amount of water, because pulling water in the airway is basically equivalent to drowning if it's a significant amount.
Do you have any follow-up questions?
No, Your Honor.
Mr. Spencer? Go ahead.
Dr. Prepper, the oxycodone or Percocet with Tylenol would have the effect of lowering body temperature, correct?
It may, and again, as I said, it depends on the amounts. The amounts have to be significant. If there are low amounts of low therapeutic amount, is not going to be significant drop in temperature.
I just have one question, Your Honor. Yeah. We don't know what Michelle MacNeill's temperature was at the time of her death, correct?
That's correct.
Very good. You may step down. Thank you. You're free to go.
Release, Your Honor.
Is he released from his trial subpoena?
We'd like to keep him under subpoena just in case, but he is an expert, so he...
Very good.
Thank you, Your Honor.
You'll remain under subpoena. You may step down today. Thank you.
Thank you, Your Honor. Can I leave the stand?
Yes, please. Ladies and gentlemen, we'll now be in recess for the weekend. Remember my admonition to you. You have a sworn duty not to discuss the case among yourselves or with anyone else, including family members and friends, and that's any subject of the trial. You are to avoid internet, television, radio, news coverage of the trial. Don't do any research on your own using your personal computers or something else. And you have a duty not to form or express any opinion about how the case should be decided until you've heard all the evidence and it's submitted to you for deliberation. Tuesday is election day. In the general election years, like 2014, there's actually a statute that requires courts to close only only be open for very limited purposes on Election Day. That's not true of the municipal election in 2013, but I do want to make accommodation for you so that you're able to vote in your various cities in which you reside. There are several ways we could do that. We could start a little later in the morning so that you can, I think polls open usually at about 7 o'clock and allow you to vote earlier in the morning. You could vote after 3 o'clock if you chose to do that. I'm just posing this to you and it lets you decide how you'd like to do that. Would you like to start a little later? Let me get a sense for that. I'm seeing a lot of heads for later. Okay, let's begin at 10 o'clock on Tuesday then. It should give you ample time to get to the polls in your various cities, vote, and then come to court. Remember to wear your lanyards so that you're identified as a juror. We'll commence at 10 o'clock. Court's in recess.
All rise.
Thank you. Please be seated. So for Tuesday, witnesses will be looking at who?
We're looking at Spencer Cannon, inmates 3, 4, 2, and 1, and possibly Jeff Robinson. He's an investigator.
Okay.
I believe we could probably get there.
And on Wednesday, we've talked about maybe calling a witness out of order.
I would say, Your Honor, excuse me, with probably in between, I get the names, in between inmates 4 and 2, probably looking at Jason Poirier.
Okay. Wednesday, we may call a witness out of order. We've talked about that. And then additionally on Wednesday, who would we be hearing from the state?
That may wrap up our case, those witnesses there, Your Honor. We can
Okay.
see how far we get Tuesday.
Very good. All right. Earlier today, we talked about some objections under Rule 404 with respect to the testimony of inmates 1 through 4. Would you like to explain what your objections are?
Yes, now I was specifically, I hadn't completely prepared for the other inmates today, but I was specifically referring to inmate number 3, and in his testimony, he would indicate that, as I understand the report, that he had a conversation with Mr. MacNeill, and that he asked Mr. MacNeill if he had killed his wife, and Mr. MacNeill said no, that he ain't killed his wife, and then later there was the use of the word bitch, and it wasn't in relation to the question of did you kill your wife, and so I think that that should be excluded under both 404 as well as 403. The other issue that we need to address as I was working on preparing last night is how do I ask questions of these witnesses about other inmates? And
About their associations with each other?
yeah,
Which ones would have a relationship with each other?
all of the federal inmates.
1 through 4?
Yeah, we have some
interaction with each other?
At some time or another, they may all have had some interaction with each other.
What I would suggest is that the state prepare exhibits that show the picture with a label inmate 1, inmate 2, and that way you can present the picture and say, do you know this person, yes or no, and then we'll refer to this person as inmate 2. And that's how I'd like you to do that. Any other 404B concerns?
In relation to inmate 4, there was a similar use of the same word.
Okay.
The inmate 4 also does not say that Mr. MacNeill made any sort of admission. The gist of inmate 4's testimony, as I read it, obviously I can't speak for the prosecution's intent, but since my mind thinks differently than theirs, I'm sure, but it's primarily, my speculation is that they're primarily bringing him to discuss a conversation that he allegedly had with Mr. MacNeill about introducing medications through an enema. And so I don't think that the use of that word is material to the case and would be more prejudicial than probative and be another bad act that would be inadmissible in the 404 as well.
Thank you. From the state?
It'll probably come as no surprise to the court that we don't believe that referring to Michelle as a bitch is 404B evidence. We think it's intrinsic because this is the person the defendant claimed to have been sorrowful over. Why did you get the surgery? Why, God, did you allow this to happen? Certainly this would be impeachment of those statements and relevant to his state of mind at the time of her death.
And these statements are made some years afterwards, is that correct?
True.
Can you give me the time frame off the top of your head?
Yeah, probably between 2011 and 2012.
So it seems to me you're hard pressed to show intrinsic when you're looking at 5 years past the event.
True, but I don't see any reason why his state of mind would have changed. Nothing's been presented. But again, it impeaches his prior statement that he might have cared.
Okay.
As far as 403 evidence, 403 objection is raised, in terms of overmastering hostility, I mean, we have someone who is accused of killing his wife. Using a word like bitch is not going to overmaster hostility in light of all of the things that are presented, including infidelity and the other things.
The reason I press you on the intrinsic issue is just that you know, the fact that a person may express contempt for another some 5 years after the event, there are, whatever they may be, ample time in which intervening things could give rise to that feeling. And so I'm just pressing you on the intrinsic issue. If I'm not thinking about that clearly, I'm happy to be educated.
A couple things. First, what could happen is not what's at issue here. There's a lot that could have happened, but there's no evidence that anything would have changed. Additionally, Michelle MacNeill was not in a position to do anything to make him angry at her after her death because she was already dead. Regardless, even if the court were to construe it as 404B, it's relevant. It's important to show his feelings about her. And we'd ask the court to allow it. Oh, there's one other factor, Your Honor, that I forgot. It also corroborates the other inmates who say that he referred to her in that way, including the ones that we allege that he confessed to her killing to.
So it creates a coherence of narrative for the state.
Correct.
Okay. Anything else from the defense?
Mr. MacNeill's state of mind 5 years later is not relevant to the elements of the offense for which he's charged.
Okay.
There is the one other inmate that Mr. Poirier again, it isn't in relation to, it's essentially, I'm glad the bitch is dead, is the comment, but I don't think that corroboration adds any significance to the statement. Either way, I think that it's 404B evidence, and I also think that it's excluded, should be excluded in the 403 as well.
Thank you. From the state, just so that my thinking is clear, what are the proper non-character purposes that you would want me to be looking at?
I think the most specific would be intent, Your Honor.
Intent to kill?
Yeah.
And we've talked about state of mind and corroboration. Anything else?
Yeah, I think the statement that counsel's alluded to from Mr. Poirier speaks more to that, but I think this, again, corroborates that.
Okay. Okay, that's very helpful. Thank you. My hope, counsel, would be to give this some thought over the weekend and do some reading and research, and I'll rule on that in the morning before we get started. Maybe if you could be here 15 minutes early.
Your Honor, I have one other matter I wanted to raise.
Yes, go ahead.
Prior to trial, there were a number of pieces of evidence excluded for various reasons, and the rulings did not necessarily or specifically address opening the door, but I believe there are two pieces of evidence that the defendant has either offered or elicited that opened the door to some of this excluded evidence. First was a question posed to Sabrina about what else her father stated to her when he first came into the bedroom with a towel over his head, and Sabrina recognized this cue and stated that he said, "Families are forever," the clear inference of which is that he cared for his family. Contrarily, the court excluded evidence that the defendant kicked his older daughters out of the house and talked about giving the younger daughters to the Bledsoes before giving them to Alexis. This evidence should now be allowed and is relevant to demonstrate the defendant was not the family man he professed to be to Sabrina, which statement and inference were brought out by the defense. Second, the defendant presented a letter of recommendation.
So I'm just making some notes. The kicking out of Alexis in the days following the funeral,
The older
and
daughters.
is it all the older daughters?
Vanessa,
Okay.
Rachel, and Alexis.
And then the Bledsoe issue.
No, I think it was July. I'm going to give the kids, or I'm contemplating giving the younger children to the Bledsoes, and then Alexis taking them.
Okay.
Number two, the defendant presented a letter of recommendation to Alexis asserting that she asked her father to provide a forgery to her medical school to impeach her. Now, while she denied this, the allegation remains, and this opens the door to the defendant's other forgeries or frauds, the identity theft, the insurance fraud, and the fraudulent filings, to demonstrate that it is the defendant who has committed and created forgeries without Alexis to vindicate Alexis of the allegation that was asserted. It is relevant to counter defendant's clearly contemplated and consciously executed impeachment of Alexis.
Thank you. From the defense? Your Honor, in both instances, well, addressing Sabrina first, her statements were gratuitous, not something that the defense intended to elicit in any way on either account. And so to assert that we opened the door in relation to that, I think there's absolutely no basis. In relation to the letter of recommendation, that was also, we didn't know what Alexis's answer was going to be, but that wasn't a question that should open the door either, because there was a certification together with that application that indicated that everything that was submitted was true and correct, and it was based upon that certification together with the application that we asked the question that she certified that letter had been been submitted and was true and correct. She answered in a way that we didn't predict. And
Which was?
she said that her father sent that on his own.
Or that she'd never seen
Or
it.
that she'd never seen it.
She was unaware of the letter.
Or something like that. I had no idea that that's what she was going to say. And obviously couldn't to impeach her any further on that, and so that was the end of that. I don't believe that there was any intent on either of these parts to get into material that the court has specifically excluded, and I don't believe that it poses any prejudice to the state either. Neither of these instances resulted in any significant evidence being elicited to the state.
Thank you.
And, Your Honor, I'd just like to comment, because at the bench conference when this issue came up with Sabrina, I was asking her about that Alexis had brought up the nanny statement, and she volunteered, oh yeah, when I was at the Bledsoes, there was something about the nanny. So there's absolutely no way I could have predicted that she would have brought the Bledsoes out through a nanny statement. When I was directing her about Dad crying in the towel, I was having her read that she was crying. I had her read the statement and said, and you said she was crying. And then she said, oh, yeah, and families are forever. And I was not eliciting that. She volunteered that. And so she brought that out. We did not elicit that.
Thank you. I don't want you to feel double-teamed. So,
No, I'm fine, yeah.
Okay.
And I think Ms. Gustin is right as far as the Bledsoe comment is concerned. I don't think they were listening to that. In fact, I don't think they want that out. So I don't think that was the case. But when I looked at Sabrina's interview, the only other thing she said at the time her dad came in was the comment about families are forever. I don't know what else could have been being asked for with, did he say anything else? And these are things that trial counsel has to contemplate. As far as the forgery is concerned,
Do you have a transcript?
I think we do. We at least have the report. Do you have the report, Jeff, of Sabrina's interview?
That was how he disclosed to her that her mother was dead.
Oh, I thought you were referring to some kind of trial transcript that you have or something.
Oh, no.
No,
sorry.
okay, all
I
right.
was referring to, if you were preparing to examine Sabrina, the only other thing in her statement or her interview would have been the families are forever, at least to the best of my recollection. I think that's the case, though. As far as the forgery is concerned, as the court probably knows, with law school or any other graduate school, letters of recommendation are sent separately, and the person has to seal the envelope and sign over it or whatever. So that was a risk, a contemplated risk that the defense took when they asked about it. And let's say Alexis did know about it. It still doesn't change the fact that assigning culpability for that forgery was still pointed at her. I think the question was a very direct leading question, and you had him do this for your medical school application, something to that effect.
I think the question was that you submitted a false letter of recommendation is the question.
I think you said, didn't you say, and you had your father submit or something like that?
No, I think that she then responded and said that he submitted it separately. It was my understanding that was all part of the package. And so based upon that, I asked the question believing that she had submitted that all together. So there was no thought process, as you mentioned, that I thought that would have been submitted separately.
I still think there's an assumption of risk there, Your Honor.
And as far as the families are together comment, that's not helpful to the defense in this case. There is so much evidence that the state has elicited that is very negative towards Mr. MacNeill. Introducing a comment does not help the defense, and is not something that we would have intentionally tried to do. There have been a number of circumstances in this case where even the state's witnesses have said things that are inappropriate. And things like that happen during trial. But we have tried extraordinarily hard to limit our examination, to not open any doors, and I believe that we haven't crossed that line in this case. There was an example even last night that I noticed as my wife was watching clips from Nancy Grace. Vicki Willis was interviewed on Nancy Grace, and if you may recall, when she testified at trial, she said that or she was asked a question about when Michelle had passed away, and we objected, and that was hearsay, because it was our belief that that was a statement made by Gypsy Willis and not Martin MacNeill. And Your Honor overruled our objection, and she testified that it was her understanding from Mr. MacNeill that Michelle died in January. Well, on Nancy Grace, she testified unambiguously that she heard that from her daughter Gypsy, not Mr. MacNeill. My point is simply that witnesses are unpredictable, and we have not. We've worked really hard to not open any doors, and I don't believe that these examples that the state has brought are examples of anything that we have done that should open any doors that would negate rulings that Your Honor has made in this case.
Thank you. This is your motion. Anything else?
I've made my record, Your Honor.
Okay. The state moves to introduce evidence that this court has previously excluded on the ground that the defense has opened the door and that changed circumstances now warrant admission. First, the state contends that by eliciting the statement from Sabrina that the defendant made on the day of Michelle MacNeill's death, that families are forever, or what's important is that families are forever, opens the door for the admission of evidence that within days of the funeral, the defendant kicked out Vanessa, Rachel, and Alexis from the family home, and that sometime in the summer of 2007 proposed that the younger children be given to or cared for by the Bloodsoes.
Your Honor, could I interrupt? I apologize.
Yes.
I believe the kicking out was June 8th.
Thank you. Yeah, it was. Thank you. In June of 2008.
I mean, sorry, 2007.
2007. Yeah, it wasn't within days. There was some. I'm thinking of the testimony that Alexis was kicked out within days because of the controversy over the nanny, but that didn't apply to the other older children. This is the June event that we're talking about. Okay.
Police responded and so forth.
Right. So that the state argues that in light of the families are forever statement coming in, then it ought to be able to introduce evidence that the defendant kicked the older daughters out of the family home in June of 2008 and in the summer, or 2007, and in the summer of 2007 proposed that the younger children be cared for by the Bloodsoes, a family out of state. The state also argues that by impeaching Alexis's character for truthfulness by use of a specific instance of conduct, namely the providing of a untruthful letter of recommendation in her medical school application, that the defense opened the door to acts of fraud committed by the defendant on his own. The defense argues that it did not intentionally elicit information from any witness designed to open the door, but has consistently sought to keep those doors closed, and that with respect to Sabrina, the statement of the defendant was volunteered, and that the defense could not have predicted the response of Alexis to the question regarding the letter of recommendation, which was that her father sent that in on his own and that she never sought. Having considered those arguments, I'm not persuaded that the families are forever statement opens the door to these two other bad acts, and for the reasons originally stated in the pretrial motions, they remain inadmissible. With respect to the forgery or the fraudulent letter of recommendation, I think the context in which that comes in is important. Rule 608 provides that except for a criminal conviction under Rule 609, extrinsic evidence is not admissible to prove specific instances of a witness's conduct in order to attack or support the witness's character for truthfulness. But the court may, on cross-examination, allow them to be inquired into if they are probative of the character for truthfulness or untruthfulness of the witness. And that's essentially what's happened here. By taking the witness stand, Alexis has placed her character for truthfulness at issue. The court has allowed her to be examined on a specific instance of conduct probative of her truthfulness or untruthfulness. and the rules provide that no extrinsic evidence would come in, and the defense has in fact lived with her answers to those questions. I'm not persuaded that by engaging in that process of impeaching Alexis's character for truthfulness, that the defense has opened the door to essentially what is conduct directed toward an untestifying defendant's character for truthfulness. I don't see that that makes sense. I also think that Rule 403 would continue to exclude these other acts of the defendant in any event, and will deny the state's renewed motion to admit the defendant's fraudulent conduct. I will take under advisement the 404B issues that you've raised this afternoon regarding the inmates. And if you could prepare those photographs so that we're preserving identity, I think that will be helpful. Is there anything else this afternoon?
Nothing from the state, Your Honor. Thank you.
Very good. Thank you again for your work. Court's in recess.